Ok, transmitiendo en vivo.
Okay, so good morning, good afternoon, good evening, everyone, depending where in the world you are. So we are right now in the workshop that we call Health Without Hospitals. So the topic of our workshop that we decided from the Andorra CityScienceLab was because, well, it's been a topic that we have been dealing in the last year's month, but now in the context of the COVID-19, so it's especially relevant, not only here, but also in the world. And this is why we decided to talk about how digitalization, how digital transformation of health could help us worldwide to design or to change the healthcare systems to be more efficient, more sustainable, more resilient. And this is a little bit the topic that we would like to discuss in this workshop. So today we will start with some short presentations that will give us some context about the topic. So Jordi Serrano will give us this context about future challenges of health and especially how digitalization, digital tools could help us. Then Vanessa from the Andorra Innovation Hub will talk a little bit an example of how in the context of COVID we could deal thanks to digitalization to fast give response without or out to the conventional classical infrastructure of healthcare systems to give response to a crisis like the COVID. Then Dr. Eva Eras will explain us about the aptitude program, that is an project with a high component of technology in order to tackle with the aging, with the topic of the aging. And finally, Oscar Chamat from Cities for Global Health will explain a little bit close about this topic. And finally, after this context, we will have a little bit a discussion in groups about the challenges and opportunities of digitalizations in health, and finally to have a joint discussion and conclusion. So just to start, I will introduce, well, Jordi Serrano will introduce herself and start with this introduction and context of the topic. Please, Jordi, the floor is yours.
Thank you very much, Mark, for the introduction. It's a pleasure to be with all of you today. We thank a lot for the invitation to Jorge and the rest of the colleagues. And let me share my screen. Just one moment. Okay, basically, I want to explain a little bit what are the tendencies of digital health, which right now is an explosive tsunami movement, no? That of course everybody's requiring. And obviously we are talking from Andorra. I'm saying that everything you can have for the future of digital health, not only Andorra, of course, we have to be humble, but this is a place where things are changing very quickly, where population is really taking seriously the COVID issue, and where the opportunities can really transform the healthcare system as in many other parts of the world. Very quickly, I'm Dr. Jordi Serrano. I'm a medical entrepreneur, GP, family doctor, and right now I'm advising the Servei Andorra de Salut, which is the Andorran healthcare system, trying to move forward what later Vanessa, Eva, and finally Mark also with the late summary will try to explain you about Andorra. And also I've been advising WHO for some years. My company, Universal Data, has been developing tools in more than 20 countries around the world, digital global health tools in that sense. Basically, Andorra, for those that don't know, it's a small country in between Spain and France, in the Pyrenees, with a small population, but a very active one, and of course, around 8 to 10 million of tourist visits in that sense. This is a graphic I like to just to show to everybody in lately in my presentation. This is a graphic that right now it's a little bit old already. It's from 2018. It was just a graphic developed by GPs and cardiologists in the United States during a weekend in a conference, just to gather and just to summarize the bombardment of buzzwords that they used to get, to listen and what is that about. And they did just some assessments about how many of these doctors in the room could really describe most of these sentences of these basic words. No, it was difficult. There are some logical and simple words, but there are other words that many of the GPs, cardiologists, many of the doctors that right now are practicing, they have no idea about. No, all this conjunction of things about digital health, big data, precision health are going to transform healthcare totally. And if you say what has to do a mobile phone with micro RNA, or what has to do microfluidics, so everything has to do with everything, and that's why the exponential transformation will be enormous in that sense. If you remember the quantified self movement like 20 years ago or 15 years ago, it looked like that it was the most advanced issue at the time. And after some years, it went down. And right now, with all the wearables and all the body wearables, I like to say, not all the things that, because at the end, it will be our body, or clinical health history or personal health record will be our own body soon. And that is transforming everything, will transform everything. Words like digital therapeutics, I don't know if some of you have heard of them, are transforming the issues. Yesterday, the federal government, German government, approved a new law that will allow physicians prescribe digital therapeutics, which is a software that has been validated with a randomized control trial. So right now, these softwares are becoming pills in that sense. I've been lucky to be a part of a group that has been request to try to write a document to try to transform healthcare system in Catalonia. This is the region neighboring Andorra. And we had a white paper to start thinking on it. And basically, the most important conclusion that the document tried to explain to politicians was that what is very important is to decentralize healthcare from hospital to primary care centers, and from primary care centers to homes. And in that sense, there are a couple of technologies that are super, super important. No? And both of them have to do with voice or with, with ultrasound. No? Ultrasound and voice will really change the healthcare system as we know it now. Yesterday also, and it's nice to have that this news, a company called Butterfly Networks, sorry, it's an American company that will really democratize healthcare, finally launch a new version of Butterfly Network, which is an ultrasound that really has a cost of $2,000 per device, and where you have all the images on the cloud. This is something that will really democratize the healthcare, because we don't want GPs sending people to hospital. We want GPs going to homes and from there making explorations and so on. And anybody in the middle of any country, even if there are no installations, can use these devices and really send information and to be diagnosed in another place, for example. Chatbots with voice recognition, chatbots that allow to control any symptomatic disease like heart failure or other diseases will be the normal procedure within the homes of many healthcare people, older people, sorry, in many healthcare systems. There are some companies that have developed algorithms that really take care of people with heart failure. And we know already with the voice, we know already with many other symptoms detected by the voice recognition and other instruments, that this person is going to be in the hospital in a couple of 3 days. So we can avoid that. Also, very quick comment about artificial intelligence. It's very important to understand that artificial intelligence will be over all the diagnosis systems, all the things that have to do. And it's very important to break it down in machine learning, natural language processing, because sometimes people have a big mess on their heads. And basically, we know that we can use artificial intelligence through, for example, natural language processing, collecting all the information with the clinical histories and transforming in a structure to an structure information, for example, to increase the number of the recruitment of people for clinical trials. That is very expensive and has been done in many European hospitals now. In Spain, for example, we have a company called IOMED, where it helps many pharma companies to increase the recruitment of the clinical trials, which is something very costly. And it's just using natural language processing and making the clinical histories structured instead of unstructured text. This is very important, and I think it's very important that the conversation between engineers, architects, software architects, and doctors can really be more simple. And sometimes doctors don't know what is a CNN, a convoluted network. Doctors don't know these things, but once they understand all these terminologies, it's so easy to have a conversation and to advance in that sense with the solutions. Very important also, the topic of digital therapeutics. As I said before, it's been advancing every month. And right now we have some solutions that can be really used as a drug. We'll come that later now in a couple of minutes. Yesterday also, no, before yesterday, sorry. One of the biggest companies in the world, Bupa, with its filial in Spain, Sanitas, they launched something called the Digital Hospital. As you see, this is a video diagnose tool using plethysmography, like the one that we're using with pulsimeters, to have with the video camera all these constants measure blood pressure, oxygen saturation, and this comes from a Israeli company, and this will transform healthcare totally also, no? Because the number of measurements that will be safe will be incredibly huge. As I said before, yesterday, the German government just passed the law to certify that physicians can prescribe software in that sense. And what is here in the corner? Many things, but just to make a summary of what we want to achieve. We want to achieve what is called the digital care delivery as a full system that can be very important to implement in hospitals, but with a lot of coordination with municipalities, with different types of healthcare institutions, depending on the continent, which are very different. But basically, what we call the digital care platform, it's a summary of the interoperability of all the systems that include remote monitoring, precision medicine used by the own patient, and so on, and all type of electronic health records, telehealth, open notes movement that is very well known in the States. Everything together, no, will be what we call the digital care delivery, and that will be something where the healthcare governments, the institutions, will be there using that digital care delivery system, but also the patients will be very involved. Just an example of how the Israeli ecosystem has put very quickly all these solutions to combat COVID, having already into account all these, what we call the digital care delivery platforms and so on. So each of these companies are working in having in mind how all these other companies are also delivering the solutions to try to connect between each other. Just to finalize all these tendencies, for example, in Holland, we have this MedMich project, which is basically the government or the institutions supported by the government, patient association, municipalities, it's very important in this topic today, have developed a stamp that recognize any application that empowers patients and that allows patients to interoperate with the healthcare system of their own city. That is very important with what we call FIA HL7 technology. And this is the way to allow innovation from one side to advance and patients be involved in the healthcare system itself. This is a very interesting project. Anybody interested, it's called MedMich project, and it's very interesting. Finally, there are many cooperatives in Europe, like the one in Barcelona called Saluscop, that what they are trying to do is to enhance, empower patients to have their own data, really, that the patients own their own data. In theory, it's true. In practice, as you all know, it's very difficult. In Germany, the same concept, my health, my data, it's been implemented in many cities. And also some of the things that in Andorra, we are looking at and other potential here in the neighbor France, a nice company called Pascal has developed a personal health record, a real personal health record that was discovered by Dr. Eva Eres, that later we'll talk to you, and many things that are right now changing the potentiality of the system. 30 seconds. Andorra has been fighting a lot in the last months, and now my colleagues will start to explain different solutions. But basically, Andorra developed a web app system to collect symptoms, developed an amazing, that Eva will explain later, system to cope and to manage, to track elder people, is developing that system, and also a brilliant serological survey that will be explained by Vanessa now. And it's been a pleasure to be with you. And thank you very much. And it will be a pleasure to answer questions and to coordinate later the part of the groups if you are in the conversation. Thank you very much.